Nearly 500 people have been dying from COVID-19 every day in Iran as it battles a third wave of coronavirus. And daily infections number more than 13,000. That's the highest the country has had since the start of the outbreak. Current prevention measures don't seem to be working. Now the government has imposed a 2-week lockdown.
The
main goal is to control spread of the virus and reduce it to a minimum rate, and to reduce the number of gatherings and people commuting. And for some places, we had no other choice than closure. In the past, we asked people to abide by protocols for their own health and to reduce pressure on medical staff. We want people to abide by protocols so this pressure can be removed as soon as possible.
Only essential businesses are allowed to remain open. And some people say they need help.
When it's closed, we have no other source of income, but there is no other choice. We should do something to curb the chain of the virus. It's tough, but there's no other choice. We need to be patient.
The infection rate will reduce, but I don't think 2 weeks is enough to control the situation. I agree with the idea of closing down 100%, yet many other problems will be created that I don't agree with, like financial problems for people. Shopkeepers still have to pay rent and their employees will receive no salary.
Private vehicles are banned from the roads from 9 p.m. until 4 a.m. Travelling outside cities is also prohibited. The government says people found to be breaking the rules will be fined, but it's facing criticism over its handling of the pandemic. 2 officials in the health ministry have resigned and issued open letters. Raza Malikzadeh says the government has mismanaged the crisis and disputes statements made by the health minister about the country's progress in finding a vaccine. The closure of businesses is making life worse for many, in what was already a tough economic situation because of US sanctions.
The Grand Bazaar here in Tehran would usually be packed with shoppers, but it's closed. Many agree the lockdown is needed, but livelihoods are at stake. 10 million families are to receive around $4 a month for the next 4 months and a $40 loan. But many say that's not enough. The challenge the government faces is whether it can persuade people to keep abiding by restrictions when they need to work to feed their families.